A compression fracture is a bone break caused by compression. It can occur due to a fall, direct blow, or other trauma. Symptoms include pain, swelling, and tenderness in the affected area. Compression fractures in the spine are often caused by a force applied to the bottom of the vertebra. The spine may collapse under this force, causing a compression fracture. Other causes include trauma to the back, tumors in the bone, or tumors starting in the spine. Several risk factors are associated with compression fractures. These include osteoporosis, which weakens the bones, age, as older adults are more susceptible, and gender, with women being more at risk due to menopause. Smoking and obesity also increase the risk. Compression fractures are diagnosed through a physical examination and review of your medical history. Your doctor may order imaging tests, such as X-rays, or a bone density test to check for osteoporosis. Treatment for a compression fracture includes rest, ice, and pain medication. In some cases, a brace or surgery may be necessary. Procedures like kyphoplasty and vertebroplasty are minimally invasive surgical interventions used to treat spinal compression fractures. To prevent a compression fracture, avoid trauma to the bone. Wearing appropriate footwear and limiting wear and tear on the bone can help. Women who are pregnant have a greater chance of having a compression fracture. Treatment for a compression fracture can be expensive, depending on the severity of the fracture and the recommended treatment. It's important to understand the potential costs involved to make the best decision for your health and budget. If you're looking for the best doctor for compression fracture treatment in Southlake, TX, consider Southlake Pain Relief. Dr. Eric I Ray and his team are experts in pain management and will work with you to develop a treatment plan that suits your needs. A compression